A 39-year-old woman who has come to us in 2014 for the first time, in 2016. When she, in 2014, just after pregnancy, her abdomen was not coming down. She felt, why was the abdomen, remaining in the same place as a pregnant abdomen? Everybody is commenting on it. But it took her 2 years to go to a doctor and try to figure out why this was happening. So then the doctor saw her, did an ultrasound and endoscopy and found that she had portal hypertension. So we are now taking a look at her liver and portal vein to see the kind of portal hypertension she may be having. And this is the portal vein, this is the liver. Okay, this is the portal vein which is very dilated. It measures 16 millimeter. If a person's portal vein is more than 15, it is highly specific for portal hypertension. So the diagnosis of portal hypertension is made just by this one view of her ultrasound. And then you can see the right atrium, right ventricle, which suggests that the heart is in situs solitus. Now the important part here for portal hypertension is, why is there a portal hypertension? So we think that it is related to her IVC and hepatic veins, where the hepatic veins cannot be seen here properly. We can see a little bit, very occluded or small hepatic veins here. As you can see, the IVC is also very much shrunken. And if I make a longitudinal thing, I can see a little bit, but it's probably also the aorta, partly the IVC. But IVC may not be as much narrowed, but in this place, particular place where the confluence of hepatic veins is expected, we are not seeing that confluence of hepatic veins coming into the IVC. These hepatic veins are all kind of occluded. So we think it's a veno-occlusive disease of the hepatic veins which has caused all this. And somehow pregnancy was responsible. Whether she had a thrombus at that point of time or not, now it's difficult to say. Okay, so what has happened is, because of that, she's got a large spleen, and we have seen her spleen here. Yeah, so this is her spleen, and you can see the kidney and the spleen, and here is the splenic hilum, which is very dilated, and this is it. These are the splenic vessels, the splenic hilum. And you can see that, one of them is an artery and one of them is a vein. Very dilated splenoportal system. So the impression overall is a portal hypertension, young lady, post-pregnancy, portal hypertension with, and possibly due to hepatic vein obstruction. That is our overall impression. Okay? So we'll close it here. Okay, so got it.